Good afternoon, fellow Kenyans. On the 27th of March this year, we announced a nationwide dawn to dusk curfew. And then again on the 5th of April of this year again, we augmented this by announcing the cessation of movement into and out of a number of counties. Later on, more measures were announced to contain the havoc visited upon us by the COVID-19 pandemic. Given this trajectory and the fact that this crisis requires, unfortunately, a long-term strategy, we took time to reflect on what must be done. If we lift the cessation of movement ban, how will this help each and every one of us fight the pandemic? And indeed, if we do not, how does this ban continue to affect our economy, especially our micro business enterprises and those who derive their livelihoods from them? So, fellow Kenyans, to answer these questions, we turn to our brain trust, our experts, some of whom are standing behind us, a team made up of the finest doctors and research scientists, as well as public practitioners, and we turn to them for counsel. And it must be admitted that opinion was divided on how we are to advance against this virus. Some, myself included, wanted us to open up now. That was and is still my desire. I know we all want to open up at the earliest opportunity and get our economy going. Me more so, as Kenya, as you all know, was recently ranked the third largest economy in sub-Saharan Africa. But others held a contrary position, and they were borrowing from history, scientific modeling, and also current experiences the world over to argue against mass reopening at this stage. Therefore, with these two viewpoints on the table, we must accept that we're not dealing with a right and a wrong opinion. We are caught in between two rights. Those who want to open are right, and those opposed to opening are also right. And this clash of two rights placed us on the horns of dilemma. In the absence of scientific consensus amongst experts in the medical, research, and public sectors, I asked for some scenarios. I wanted to know the worst-case scenario and the best options that are available to us in order to contain the disease without affecting the economy irreversibly. Fellow Kenyans, we must speak truth to each other. Had we not taken the stringent measures that we did in March of 2020, the rate of infections in Kenya would have peaked to 800,000 people by July 30th of this year. And if, as we have seen is the case, that one infected person has the potential to infect two people, this number would have hit 2.4 million people in 21 days. By the end of August this year, had we not taken the actions that we have taken, approximately 75,000 Kenyans would have lost their lives from this virus. But because we took interventions early, we have recorded only 2,600 infections with 83 deaths. So therefore, fellow Kenyans, if this is the worst case scenario, we wanted to know what the other scenarios look like. So if today we put in place all the necessary interventions and relax these by only 20%, what would this look like? According to the experts behind me here, relaxing interventions by 20% would lead to 200,000 infections and 30,000 deaths by December of 2020. Further, if we relax the interventions by 40%, the infections will peak in November with 300,000 infections and 40,000 deaths. If we were to go even further and relax them by 60%, the pandemic will peak in October with 450,000 infections and 45,000 deaths. Although these projections are generated by a model, our experts have shown us hard evidence suggesting that countries which opened up without proper protocols also experienced serious waves or secondary waves of infections. Spike of infections were, for instance, experienced when religious gatherings were allowed in South Korea, Pakistan, and Malaysia. So if this is our new reality, and we face the dilemma of easing restrictions or continuing with them, the question then is, what must we do as a country? What is our irreducible minimum for reopening the country? What is the threshold below which we cannot go? Once again, according to the professionals with us here, the irreducible minimum for lifting restrictions has 3 thresholds. 1, to open up, the infections must be contained and the number of infections and deaths must be headed downwards. This is currently not the case in our country. 2, our healthcare system must be prepared sufficiently to take on a surge in infections. It must not be overwhelmed at any one point during this pandemic. Access to testing, isolation, and quarantine must be a bare minimum in our health facilities. This is not currently the case. 3, the capacity for surveillance and contact tracing must also be fully in place across the country. So the question then we must all ponder together, fellow Kenyans, is whether we have met this threshold or these 3 thresholds in order to lift the restrictions. Have the cases, as I have said, of infections taken a downward turn, for instance? The answer is definitely no. We are seeing an increase Have we met the second minimum of prepared health systems with isolation? Again, as I said, the answer is no. And I just give two examples. Siaya County has only a 10-bed isolation facility, and already they have admitted 9 COVID patients from only one incident. Similarly, Busia County has a 34-bed isolation facility, and 2 days ago, that facility was full. So, fellow Kenyans, if there is a surge in infections in just these 2 counties, the healthcare system will most definitely be overwhelmed. So the hard question to pose here is whether Kenyans are prepared to nurse COVID-19 patients in their homes if our healthcare system cannot handle the numbers. Are they prepared to expose their children, to expose the elderly to COVID-19 patients in the close proximity of home? And yes, we have dispersed Kenya shillings 5 billion to the counties in order to assist them increase their healthcare capacity in view of this pandemic. But to build the necessary health infrastructure for such an undertaking requires time. We must get ahead of this pandemic by creating lead time. So therefore, fellow Kenyans, while considering the possibility of de-escalating the containment measures in place and conscious that health is a shared function between the national and county governments, I have convened today an extraordinary session of the National and County Government Coordinating Summit on Wednesday, the 10th day of June, to consider the following salient matters. First, to review the effectiveness of the containment measures we have taken so far, those that have been rolled out to break the chain of transmission of the coronavirus disease. The second, to secure the undertaking of every county government to deliver isolation facilities with at least a minimum of 300 beds. And thirdly, within 14 days, to develop time-bound protocols for progressive reopening of the economy. fellow Kenyans, with my colleagues and having applied our minds to the different scenarios presented by our experts, I have reconciled myself to the fact that to open or not to open is not a dilemma between a right and a wrong. It is a dilemma between two rights. And because of this, and fully cognizant of the irreducible minimum given by our experts, and in keeping with the advice of the National Security Council, I today hereby direct an order as follows: that the cessation of movement into and out of Eastleigh area of Nairobi and the specific limitations in force with respect to the Old Town area of Mombasa that is currently in force shall lapse at 4 a.m. on the 7th of June, 2020. That in view of the successful containment of the disease in the counties of Kilifi and Kwale, the cessation of movement into and out of the two counties that is currently in force shall also lapse at 4 a.m. on the 7th of June, 2020. 3, that following stakeholders' consultations in the education sector, the Ministry of Education, jointly with the Ministry of Health, issue and publicize guidelines on a gradual and progressive return to normalcy in the education sector by the third term, that is, from the 1st of September 2020. Further, that the Ministry of Education shall announce the new school calendar by the middle of August. As you are aware, on Madaraka Day, I did direct that the Ministry of Interior, the Ministry of Health, hold consultations with interfaith and religious organizations. So today, we state that following these consultations, within 7 days of today, the Ministries of Interior and Health will constitute an interfaith council to work out modalities and protocols of reopening of our places of worship. 5, that in the meantime, the ban on all forms of gatherings, including but not limited to political gatherings, social gatherings, including bars, be and is hereby extended for a further 30 days. That due to the evolving nature of the disease globally, international travel restrictions are hereby extended. In the meantime, the Ministry of Transport is directed within 7 days from the date hereof to engage all key stakeholders and develop protocols and guide resumption of local air travel. That due to the increase in patterns of infections, the cessation of movement into and out of the Nairobi metropolitan area, Mombasa, and Mandera be further extended by 30 days. That the nationwide dusk to dawn curfew currently in force until today, the 6th of June 2020, is extended for a further 30 days. However, the commencement time for the same shall be varied from 7 p.m. to 9 p.m., with the end time for the same being varied from 5 a.m. to 4 a.m. Therefore, effective 7th June 2020, the nationwide dusk to dawn curfew will run from 9 p.m. in the evening to 4 o'clock or 4 a.m. in the morning. This variation should enable Kenyans to have a full workday schedule.